Hi, my name is Chris Pasero. I have to tell you, I am at a stage in my life where I don't know if the glasses help or don't. So I'm afraid to go without them, so I keep them, but I don't think they're helping. And these are new, so bear with me here. Yeah, they would look cute on me, I think. I'm a nurse, and I think nurses see firsthand how all of the adverse effects that chronic pain has on the people who have the condition. People with poorly managed chronic pain see those aspects of their life deteriorate every single day. Everyday activities that you and I do, such as combing our hair or cooking a meal, can be agonizing for somebody who has chronic pain, and holding a job may be absolutely impossible for some. Many people with chronic pain are unable to experience simple joys of life, such as walking a dog and socializing with friends. I can't tell you how many patients have told me they've never been able to bend over and pick up their children or their grandchildren because of their pain. And I think it is a big misunderstanding to think that people living with chronic pain, as you alluded to, Myra, do not have as much disruption of their lives and the lives of their family members as people who have a life-threatening condition or disease, terminal illness. The difference is, as you said, Myra, the suffering endures for many years. The American Chronic Pain Association describes chronic pain as a family disease, and that is because every person in the family experiences the suffering and the heartache that the person with the chronic pain has, and it can overwhelm even the strongest of families. People who are terminally ill often have the advantage, although I'm learning today not as much of an advantage. I went through this recently with my parents and had the advantage of palliative care, so bless all of you for that. It was, I don't think we would have made it had we not had that, but I think they have the advantage of palliative care, but people, so they've got pain specialists, they've got support systems, they've got appropriate treatment. Palliative care is severely underutilized by people who have chronic pain, and even though so many of them would benefit from it. Coupled with the current shortage of healthcare providers who know how to manage chronic pain is the reluctance and sometimes the complete refusal of a primary provider to even attempt to manage chronic pain because it's not viewed as a disease. The person with chronic pain pays the ultimate price. I recently spoke with a 58-year-old woman with breast cancer, and it's in remission now, but she unfortunately has been left with constant joint and nerve pain from the cancer treatments that she underwent. And because her cancer is in remission, her primary physician will no longer prescribe the medications that were being used to manage her pain. He has told her he does not feel knowledgeable, he doesn't feel comfortable prescribing any of the medications, and he referred her to a pain specialist 200 miles away. I see that a lot. Too often, chronic pain is considered a psychological response or a sign of laziness or weak will. We've heard a lot of this in the last couple of days here. In addition to the physical suffering that these folks experience, they often also have to experience the humiliation when healthcare providers and, frankly, society. I was so struck by the woman, and you said that she said that her doctors hate us. She was talking about being a person with chronic pain, but what she also said was everybody hates us. So society in general minimize or dismiss their reports of pain. The mother of a close friend of mine lived with severe osteoarthritis pain for 52 years. It was a constant struggle to try and find appropriate treatments for her, healthcare providers that would prescribe appropriate treatment. She was given a wide range of advice during her 52 years of suffering, including, you'll have to learn to live with the pain. It's normal to have pain at your age, even though the onset of her pain was at the age of 30. Over her lifetime, she experienced numerous adverse and life-threatening events, from inappropriate, drug dosages, inappropriate treatments for her pain. And not once was a, behavioral psychosocial intervention prescribed, not even a non-drug intervention, other than you need to learn to live with your pain. I suppose that's a non-drug intervention. The day after her 82nd birthday, this woman was diagnosed with metastatic colon cancer. And the last time I saw her, she told me that from the day that she was diagnosed with cancer, her reports of pain were never questioned, and she received appropriate, prompt treatment. Coincidentally, for her cancer pain. Coincidentally, the treatment of her cancer pain also relieved her osteoarthritis pain, with, I might add, a relatively low dose of opioid. So she did experience a satisfactory level of function, social activity. She was able to die comfortably in her home 6 months after her diagnosis. I think it is both sad and shameful that this woman endured 52 years of unrelenting pain that might have been relieved had a healthcare provider had the knowledge, been available, been willing, had taken her reports of pain seriously. That was not the case. And unfortunately, this is a story that is all too common. I hear it all the time. So I want to thank you, Myra, for inviting me to join the group.